So today I want to talk a little bit about two studies that me and my colleagues have published, and maybe just also general about the topic. So the reason why I started looking into this field is that we knew that anxiety and depressive disorders were among the top 10 causes of years lost to disability among youth. We had evidence of declining mental health among adolescents in Western countries and also in Iceland. When I started in this field in 2013, there was a lot of talk from school psychologists, from parents, from people in the lives of adolescents that something was changing, that symptoms of emotional distress were increasing, specifically among girls, and anxiety was the symptom that was mostly talked about at that time. And so me and my colleagues, we kind of started diving into what had been happening over the years, looking into the trends and also examining changes in modern society. And that's kind of where the arrival of social media came into this, although we did look at several other factors as well. So when we started out, we took data from 2003, created a cutoff point just to be able to gauge the differences in those that were identifying as having high symptoms. So these are not clinical symptoms in any sense, but we took the top 5% and then we just examined the trends over time. And we could definitely see that in 2014, there was a change in symptoms of depressed mood for girls and not so much for boys, but we can see that the boys have been going a little bit up and down over the years. So what does this necessarily mean? Well, we weren't really sure. So as I said, we started in 2014. We could see an increase enough that we started to gather the field to talk about it, but maybe not enough to cause widespread concern. Something serious is happening because, as you know, these are population studies and they can change up and down. But then we saw symptoms of anxiety for girls had increased as well, and then it went down in 2018, and then it slowly started climbing up again. So 2021 is in March. We conducted a survey week before we went into lockdown due to COVID. So when COVID was just far from our radar in Iceland. And then another survey was conducted in October. So this is during lockdown, when children were being homeschooled. And then in 2021, when we had also COVID. But we can see also from data in 2022 that this isn't changing, so that the increase in mental distress, which was already increasing, hasn't really gone down. So we're looking into an issue that had been manifesting and growing overall since 2014 or 2013. And then we had severe lockdown and COVID, and it hasn't changed. So even if society is returning back to a new normal, we're still seeing the similar increase as we did during COVID. So why did we go looking for social media? Well, I think social media is the most obvious change that we see in society over this time. That being said, we also had several things that happened in Iceland. We had the bank crisis. So the children that were children, and when the bank crisis hit, they were adolescents in 2014, and they are still adolescents now. So the youngest, those that were born during the bank crisis, those are still adolescents. So there are various other factors that we can pull into this than necessarily social media. But the narrative around social media was very conflicted. It was considered very harmful, while others considered it as harmful as eating potatoes. So the science wasn't really clear on this. And we had really good data in Iceland that had been collected over a long period of time. So we started looking into social media really due to that. So we wanted to kind of add to this discussion, understand it better. Because as I'm sure you've all noticed, the narrative is quite negative around social media. We have, there's a lot of blame game going on. We tend to say that is the culprit in all of this without necessarily having enough scientific backing to be able to say so. And so social media, why really we started looking into social media? Well, previous studies have shown that when adolescents are moving from preteen to teen years, we know that identity exploration increases. The need for peer acceptance becomes much more important. And social media changes the nature of the context and contact that we have with peers. There's constant feedback, there's the public display of the self, which possibly amplifies peer identity, acceptance. We have fear of missing out. Social media is the perfect platform for social comparison in all directions. You can pretty much compare with whatever you want to. It has been thought to exacerbate body image concerns. So there are just so many processes that are already going on when you're an adolescent, that are just magnified through social media. And so we really aim to fill the gaps in understanding both the longitudinal relationship between social media use and symptoms of anxiety and depressed mood among adolescent boys and girls, and also to try to understand the different patterns of social media use and how they relate to adolescent psychological distress and how it's different for girls and boys. And we know that symptoms of depressed mood and anxiety increase as you grow older. So it's not enough to compare cohort to cohort to cohort. So saying that comparing 14-year-olds to 15-year-olds to 16-year-olds, we have to have within person comparison if we're going to say that it changes, because the problems usually grow as they grow older. So we published the study looking into the longitudinal associations between social media use and psychological distress among adolescents in preventive medicine. So this is published in 2020. And just to give you a little background, because I always want to have a little background when people talk about their study, so I know where I can find it, is that it was a longitudinal study. We were looking into a cohort of adolescents that were born in 2004 in Iceland. We collected survey data when they were 14 and 15, and it's part of the life course longitudinal study. So these were all adolescents that were born in Iceland. They were approached. We had 2,221 that participated. So it was 60% of the entire cohort that participated. And we measured depressed mood, and we measured social anxiety and physical symptoms of anxiety using 2 dimensions of the multidimensional anxiety scale for children. And then we measured time on social media. And we controlled for gender, family structure, and parental support. And the short version was that time spent on social media was associated with increased symptoms on all 3 emotional distress outcome variables over time. The impact of time spent on social media on these symptoms, on symptoms of depressed mood and physical symptoms, so not on social anxiety, grew stronger over time. And we could see that the relationship was stronger for girls than boys on all variables. So this was pretty much confirming what we had already thought. But that being said, the effect sizes were pretty low. So there was a significant association, but the effect size was not very high. And so where to from this? Okay, we understood that the time factor, so as they grow older, the association grows stronger. It's more for girls than boys. And it tends to grow with age, which is similar to what we thought. So this was actually published before, because that's sometimes how it goes in the literature. So we started looking into the different types of social media use. So what does it mean? Are we able to kind of weave out how they're using social media? And we adapted the scale from Friesen and Egermont on active and passive Facebook use to include all forms of Facebook. So this is published in 2019. This study is, the data from this study is from 2018. And just keep in mind that we didn't have TikTok at that time, for example. So social media changes very fast. We're measuring something that's moving very, very fast. And so this was a cross-sectional study based on the population in 2018. We had 13 to 16-year-olds and about 10,500 students and over 80 I think, an 85% response rate. So these are basically all of the students in compulsory school in Iceland in the upper classes. And we measured depressed mood, anxiety, time on social media, active and passive social media use. And then we put in variables such as peer support, body image, self-esteem, and social comparison, trying to control for it. So first we were looking into a mediation relationship, but then, of course, since this data is cross-sectional, we couldn't really go there. So we controlled for it in a hierarchical linear regression. And the short version is that we found that spending time on social media in general was related to symptoms of depressed mood and anxiety. And this is just a single variable measuring time. We saw that passive social media use was related to greater symptoms of anxiety and depressed mood, and active use was related to less symptoms of both. But after we added in self-esteem, social comparison, peer support, and body image to the model, only passive use remained significantly associated to these greater symptoms. And as before, the relationship was stronger for girls than boys. So we could see that there was an increase in self-reported symptoms over time, anxiety and depressed mood among Icelandic adolescents, and especially among girls. We know that social media use is related to symptoms of emotional distress. We can see that after we include risk and protective factors, that the ones I mentioned before, passive social media use is only related to emotional distress, but not active social media use. And what I mean with passive and active, I should have maybe talked about that before, is that passive is when you're scrolling through, you're not engaging with everyone. It's not necessarily social. It's more like a passive recreational activity where you're just scrolling, you're looking at other people's profile. While social means that you're posting something, you're having a conversation, you're engaging with somebody else, or with a platform even. And that and we could see then that the gender differences were quite evident. But there are certainly limitations, very many limitations to our findings. For example, we only have one measure to measure this time spent on social media, which if I ask all of you, how much time did you spend on social media yesterday? It's extremely difficult to look back and try to figure out how much time you spent, because it's not like it happens in one stretch. It's not like you go to training and exercise where you spent an hour and a half. It's more 10 minutes here, 5 minutes there. Maybe you fall into an Instagram frenzy and stay there for 90 minutes going through other people's accounts. So it's very difficult to measure for yourself how much time how much you spent. We didn't differentiate between weekend and weekday use, or measure any kind of actual use. We relied solely on self-report data. The questionnaires were only in Icelandic, so we're missing out also part of the population that is not able to answer in Icelandic. And we know that people that, well, the studies have shown that people tend to overestimate or underestimate the time that they spend. Oh, I didn't mean to go that far. And we only measured one developmental period. So we don't know if this translates over when they're older, and we don't know when it starts. So if this association holds true, when does it start? When can we see it? Because we're measuring 13-year-olds. We see from data from 2022 that a lot of children, 9 and 10-year-olds, have social media accounts and interact with their social media multiple times a day. So we are missing out on that developmental period, and we're also missing out if this just phases out as they grow older, as they learn how to navigate. Keep on going back and forth. So what next? I think we need to use better measurements. These are of course old data, so I can only speak to what I have. I know that there has been a very fast development in this field, and we get more and more measures and better techniques to be able to measure. We have the phones themselves are able to measure social media use by having surveys that people log in. How much time have you spent in the last hour? So we have better like mini diary measurements. We need to be able to weave out the context of social media use. Like, what is it about social media use that we think is harmful? What is it about social media use that we see has this effect or this association? And what content is possibly dangerous for adolescents' mental health? And I assume if we think about it, it's going to be very different depending on also where you're at. We know if you see a lot of content for self-harm and you are thinking about self-harm, that it's going to have more an effect on you than those that weren't thinking about self-harm that see content on self-harm. And based on conversations that I've had with psychologists, is that they youth is coming in with various problems, and social media is very often part of the problem. And it can be that they are seeing things that exacerbate how they're already feeling. We need to look into the bidirectionality of it. Is it social media that's causing or has this negative impact on our mental health? Or is it that we have poor mental health and that's why we're leaning on social media? And also looking into other outcome measures. So what I have seen from the literature is that we have small effect sizes usually, and some scholars tend to dismiss small effect sizes as not significant, and it's so small that eating potatoes, it's just as harmful as eating potatoes. But when we think about adolescent mental health, all mental health, our mental health, it is the day-to-day activities that make up our mental health. It's not some 6-week intervention that's going to create our good mental health for life. It is daily exercise. It is getting enough sleep. It is having positive peer relationships. And if we think about social media, there is an indicator that peer relationships have definitely changed. And if we think about how it influences girls more than boys, we know that girls rely a bit differently on peer relationships during their teen years than boys. So we need to think about the day-to-day activities. So I for one say that even though we are seeing small effect sizes, at least in our studies, we shouldn't dismiss them as insignificant, because that's how we build up mental health, with the small things that we do daily. Yeah, I don't think I have anything else to add. So just thank you for your time.